See Me, Hear Me initiative has been created to support anyone living with or affected by ANCA-associated vasculitis, a rare and complex disease also called AAV. It was developed by Vifor Pharma following extensive research, which highlighted the emotional burden of the disease and the wide range of different feelings experienced as the AAV journey progresses.
We are very, very grateful about the support of the patient associations across Europe, the patients and the carers that we had the opportunity to work with, but especially Shanali Pereira, who's not only an artist, a rheumatologist by training, and a vasculitis patient on her own. She did not only create the artworks for the See Me, Hear Me campaign, but did influence the content. So what we create is of meaning for the patients and the carers.
I was working as a rheumatologist when I was diagnosed with vasculitis. It was truly a humbling and transformative experience, both personally and professionally, giving me valuable insights into what the patient's journey is really like. Up until then, diagnosing, managing, treating conditions was more of a black and white reality for me, but going through the patient's journey was a reality with many shades of grey. Suddenly, I was dealing with multiple layers all at once. I felt powerless. I could not control the direction my life was heading. And when things really started to progress, 2.5 years later, I had to give up my career. At that point, I felt robbed of all my dreams and expectations just gone out of the window. And the illness dominance really distorted my image, my identity, who I was as a person. How I got on top of this battle was using the creative process. I could not control how the illness was evolving, nor my day, but I could control what I create, which gave me a sense of purpose, a sense of achievement, helping me to regain some control, and that certainly was a turning point for me.
To find out more, visit myanchorvasculitis.com. Vifor Pharma also has a dedicated website for healthcare professionals dealing with AAV. To access it, visit understandaav.com. We would like to thank Shanali and the other patients, carers and patient association groups who have worked with us to make See Me, Hear Me a helpful resource for everyone touched by AAV.